Patrick, it's great to be with you today.
Thank you, Stan.
How are you doing?
Fine, Stan. And you?
I am excited. It's never been a more exciting time to be in dentistry.
Okay, yes, sure. But it's very interesting show.
Yes.
Because we can see a lot of people and a lot of new products.
Yes. And my thought that I have, and it's something I wanted to actually exchange some ideas with you on, is what is the role of the dentist today? What is the definition of oral care today? Because it's no longer drill and fill.
Yes. Yes, today we have a new definition.
Yes.
FDI has a new definition, and I can read for you because it's
Yes.
not so complicated,
Okay,
but it's very important. And oral health is multifaceted and includes the ability to speak, smile, smell, taste, touch, chew, swallow, and convey a range of emotions through facial expression. And what is important, in fact, is that we are in a turning point in the dentistry. Because today, the dentist is a technical approach, you understand?
Yes.
And after this technical approach, we have the medical approach.
Yes.
And I want now to have the psychological approach, the social approach.
Yes.
Because the dentist is not a medical profession, it's a social profession. You
Yes.
are responsible of the quality of life, of the
Yes.
well-being.
Yes. And I think that's very, very important, because at the end of the day, we now know that those people that have a very good psychological environment
Yes.
are likely to be healthier.
Yes.
And we also know that non-communicable diseases are so important, because I think even in the United States today, 2/3 of the cost of healthcare related to non-communicable diseases.
Yes.
So much is related to the state of mind, and to be a good state of mind, you have to have good teeth.
Absolutely, you are right. And today we are sure that we have a global approach in non-communicable diseases. I can give you different examples. For example, with diabetes. Diabetes is a very important problem worldwide. And you know now we have a big relation between the gums, between the parodontologist and the diabetes. The dentist can diagnostic the diabetes tomorrow.
Right.
And it's very important to have this global approach with the diabetes, with cardiovascular, and with inflammation. And we have a big importance now to understand the responsibility of the dentist in the medical and in the global health.
Yes, and of course it's medical, but of course we also know today that medical is beyond the biologics. It is psychological.
Yes.
And there's no question, and we've seen this so often now in different reports, that people that feel good about themselves are more productive, are healthier. We also know, as you said, that there's an enormous correlation between good oral care, good health care, even to the point of obstetrics.
Yes.
We now have studies to show that women who take care of their teeth are likely to have to give birth to healthier babies.
Yes, absolutely. And now we have a global approach also in education, because the responsibility of the dentist is not only to treat, is not only to prevent, but is to educate. Because in fact, the most important is to educate. Because if you have the possibility to educate all people, the children, but the pregnant women, the adults, the young people, and the elderly people, you have to responsibilize. Because what is the most important for you is you, is your self-esteem, and is your approach. And if I can educate you, responsibilize you, it's finished for me. I am the winner, because you know what is the most important for you? Your health and your oral health.
So it's how you feel about yourself, and the interface between oral care and healthcare. It's a triangle. The psychology, the oral care, and the other side is the interface between those two, and healthcare and health in general.
Absolutely.
So it's a three-pronged stool.
Yes. In fact, we are, as I said before, we are on a turning point, because today the study, for example, the study and the education of the dentist is often exclusivity on the treatments, on the technical approach. And now we have to add 2 points. The first point is medical approach, as you said, but also the psychological approach.
Absolutely.
Because we have to understand that I am not responsible of your teeth, I am not responsible of your mouth, not your body, but the people, the spirit of the people. And it's fantastic, because it's a very interesting job, because it's not only the technical job.
Right. So if you combine that philosophy with the notion that in dentistry today, we are in what many call the fourth industrial revolution.
Yes.
The first is, the cottage industry and the smokestacks. The second was the production lines, the Ford,
Yes.
Daimler cars.
Yes.
The third was, of course, the PC, the mobile telephone, bringing them together. And now we're into what's called interoperability.
Yes.
The computer, the cell phone, and everything connected.
Yes.
So dentistry is now experiencing the fourth industrial revolution, which is about the interoperability of every device connected to the home, connected to everything that a dentist and a patient does, bring the patient, the dentist together. And so that new world of digital dentistry combined with the new findings on oral care in general, what a time to be a dentist.
Yes, we have to live in the system. We have to live in the year. And in 21st century is a communication. And we have to work together because the industry can give us the toolkit, the tools to communicate. Because today we have to communicate not only in the dental practice but also outside. And for example, we have to introduce new relations, not with our patient, not only when he is in my dental practice, but also after, before and after the treatments. And for that we have Facebook, we have all the possibility to communicate. And we have to create this relation, this new relation between the dentist and between the people outside the dental practice. And we have to, in fact, to follow the patient, our family, not the patient, the family of the patient during all his life. You understand?
So here's the question. We are clearly today in a global world. Some people deny that, but I think clearly we are in a world that is global. Look what's going on here. There are people from every country in the United Nations walking around this floor.
Yes.
All interested in common dentistry.
Yes.
How do we find a way today to ensure that everyone in the world, all the leaders of the world, know the importance of oral care?
For that we have in fact, we have not one solution, we have a lot of solutions. And for me, always is a complementary between the media, between the political, between the dental association, the dentist and the industry. You understand? For example, what is very important for me, maybe you are not happy with that or you are not agree with me, but for me is the advertising. The advertising on TV, with the media. Because everybody is very interested by the advertising, and we have to work together with the industry and to promote with the products, to promote the interest to have a good oral health.
Right.
In fact, today we have Facebook, but in fact we have no communication.
Right.
In fact, everybody is interested by himself.
Yes.
And we have to introduce the quality of life, the well-being with that. Because how is possible to smile, how is possible to speak, to have a social life, to have a love life, how is possible to drink without kiss, without the dentist, without the good oral health. And we have not to speak about oral health, we have to speak about, for example, sport. We have tomorrow, we realize a new workshop about sport and dentistry. Because you had a big connection, not only for the professional, but also for everybody.
Yes.
And we have to introduce dentistry, oral health in all the situation in the life of the people.
But we need to take it global.
Yes.
Because we know that oral care is good for health.
Yes.
We know that oral care is good for psychology, good mental health, good for health in general.
Yes.
But it's not fair to only make this available to a certain part of the population.
Yes.
The whole world needs to know about it. There is only one global healthcare professional association.
Yes.
It's the FDI.
Yes.
And of course the FDI has made enormous strides, most recently to bring inclusive and including people from every walk of life throughout the world. What can we in the industry do to help the FDI in really advancing oral care around the world, or the importance of oral care?
Yes, the responsibility of FDI is also to advocate. And we advocate, for example, with the government, with WHO, but also we have to communicate, and to communicate in the dental practice and with the patient. And I think the role of the industry, if it's possible, is to help FDI to communicate. Because today you have to communicate how it's important to have a good oral health.
Right.
And not only, but also with the dentist. Because you know that often not always, but we have also a few dentists who imagine his work only about treatments. And you have to open the spirit of the dentist. You have to open the dental practice. And in the dental practice is industry and us together. I am the voice of more 1 million of dentists. We have a federation, dental association, and we have a dental association in all the countries. And with that, we have a lot of possibility to do. And we have to do at the global level between us, but also at the national level and local level.
So many dentists may or may not agree with this, but to me, the only way good is achieved in this world is through what many call public-private partnerships.
Yes.
And in our case, it's a partnership between industry, the profession.
Yes.
Between industry, the profession, government. Between industry, profession, multinational organizations like the World Health Organization. Between all of us, education institutions and NGOs.
Absolutely.
And it's not easy. No one forces us to come together, but we have to create. And I think we should do it with the FDI, the magnet to bring us all together.
Yes, absolutely. And we have, I think it's possible now because we have, with these new definitions, it's very clear. Now we have a new approach of the dentistry. And with that new definition, we can have a very, tomorrow we have the measurement tools for this new definition. And we can evaluate exactly the level of the oral health in all the countries. And after that, we can discuss with the government and with the media about the quality of the dentistry. I think it's possible now. But you are right, we have to discuss together and we have to do together. And we have not only in the dental practice, outside dental practice, with the government in particular.
It's very important. And with big companies.
Yes.
You know, big companies are spending a lot of money on healthcare, and governments are spending money. So the only way really to do this is for us to go and explain to industry that it's good for industry to have the dentists busy. It's important for the dentists to understand they have to work with industry because together we can go and get patients. We need to explain to the government that if they have patients going to see the dentist, the population will be better off, there will be better economic growth, and whoever pushes for it will get elected to government. So it's in everybody's interest.
Stan, you must become a president of FDI. You know exactly. I agree totally with you. And now, but it's step by step. You know that.
Right.
But for me, it's very important to explain that without industry, we have no dentist. And without dentists, we have no industry.
So
we are together in the same boat. And we have to explain that. But also, you have to explain our responsibility in the social life, our responsibility in the economy life. Because we have a lot of loss of day in school and in the company. Only with a bad oral health. And we have to explain that because we have to go out the medical approach. We have to go in the social life and in the economical life because you have a lot of money, as you said. A lot of money is spent about oral health.
Lost opportunity. And you know, Benjamin Franklin, one of the founders of America, once came up with the concept of enlightened self-interest. Self-interest for myself, but also for society. Self-interest with a light. So we can do well together by doing good.
Absolutely.
And if we can get each other's constituents excited about where oral care is going and what oral care can do, and get everyone in our community and governments to embrace your definition, I think we will do very well for the world and for society. Not easy, but as President Mandela once said, it always seems impossible until it's done.
Absolutely. Stan, if it is easy, it is not interesting for you and for me.
So I will tell you, we are happy in our collaboration with FDI.
Thank you.
And I can tell you that industry is now finding it very interesting to work with FDI because industry is ready to help. But we only help if there's somebody on the other side who wants help and wants to take action.
Okay.
So I thank you very much for this wonderful time.
Stan.
Look forward to working with you, Patrick, in the years to come.
Yes.
And we're in a very exciting time in dentistry.
Yes.
Look at the activity
very
on the show.
Yes, we have a very interesting moment.
Thanks.
Sure. Thank you, Stan. Thank you.